At this time now I have the pleasure of introducing our second keynote speaker and our final session for the day. Dr. Rocio Saenz is Executive Director of the Network for the Americas for Health for Costa Rica and former Executive President of the Costa Rican Social Security Fund. She has served as a researcher at both the undergraduate and postgraduate levels in the schools of medicine, public health and nursing at the University of Costa Rica. At present, she coordinates the Patient Navigation Project, the Permanent Forum on Cancer in Women in Costa Rica, and the Research Project on Primary Healthcare. If that was not enough, she also serves as the Executive Director of the Network of the Americas for Health Equity and works as an international consultant and researcher in health systems. I'm really delighted that you're with us here today. I'll hand the podium off to you. Thank you.
Good afternoon. Thank you to Louise for this presentation and to invite me to have the opportunity to talk to you for my own experience and about my country. And also I expecting that our experience could be useful for you as a global. For me, this all day was a very important moment, and I received a lot of ideas and new forms to see the global health. I hope you can enjoy my presentation and after have some questions. My presentation it's around how we can build, the governance and the relationship with the partnership with the different actors. Taking the vaccine program as as an example, but it's not only the one idea, one successful experience we have in Costa Rica. My content is, I will talk about a little bit the context, the Costa Rican health system a little bit, the vaccination, some lesson learned, and some challenge that I fixed that is important for this moment. First of all, I want to say that the Costa Rica is a very small country in the middle of the Americas, in Central America, between Nicaragua and Panama. We are a very democratic country. Since the 1948, we start building our health system based on the Social Security Fund, but also based in primary health care. And this is one of the, the difference that we have than the other countries, because we start with the primary healthcare before Alma-Ata. And I think this is a very important issue and has, the identity for our health system, because we start with the Hospital Without Borders in San Ramon, who was a very huge experience how the doctor went to the communities and start working with the communities, listening to the communities, involve the communities, and building together, the response for the health system. This is in our DNA, in our health system, and for that, our health system is some kind different than the other parts of the world. The other aspect that I want to say is that our health system has a comprehensive view, and our concept for health is not only be without disease. When we are talking about the health, we are talking about the well-being, we are talking about the people has opportunity for education, for be free, to be in a democratic way. We don't have army. For us, it's unbelievable to have a weapon to use for another person. And all of those issues are in our minds and our spirits and in our health system. And with this first idea that I want to say that the vision for Costa Rica, we are different. All of us are different in our countries. But in the case of Costa Rica, the belief of the democracy, it's totally specific for the Costa Rican people. And also the inspiration for the biodiversity that we have. We have a long history to really keep our land, our biodiversity, and also we believe in life. We believe the people can live better, and we are very optimistic. With these comprehensive programs, we start with the health promotion to the end of life programs. This is very important to say because it's not only, I repeat, not only don't be without disease. It's how you be free and you experience the freedom and how you have the opportunity and the capacity to really look for the opportunities and take the decision. It's not only to be, a people that they want to be without the Ebola or malaria or TB or cancer. It's how you really has the well-being for you, for your family, for your community. This is the first idea we want to share with you. The second is our health system is when I say it's different, it's because the health minister doesn't have any services to provide to the population. The Minister of Health is in charge of the policy and how to address the collective benefits for the people. We have the other institution, the Social Security System or Social Security Fund, Caja Costarricense de Seguro Social, is the only public provider for all services that we provide for the whole population. And this is based on the Social Security Fund, but is the financing are coming from especially for the workers, for the employees, for the government and for the states, but also the state add money for the people who doesn't have employed. And the people who are poor has the same opportunity to have the same services. There is no difference. There is not the segmentation and no fragmentation. We are the really unified system. Right now, I was talking on the table, it's the first time that we have in the Costa Rica a really stressful position from the government because they don't want to pay, the responsibility they have to do it. This is the first time in more than 80 years. I say here because you are in the global arena and you know my country, you know our system, and we need your help to really protect our health system. Not only for Costa Rica, but only to be the real experience for all over the world. We organize the health system like in other countries with the first and the second and third level. In the first level, we have the teams that we call Ivers, who is the teams that they are working at the community level. There is a doctor, a technicians, and community working, visiting each household. They take a census for the populations each year. We have this in our EDUS, who is what I can say, the record, the health record. And also we have this information with the entitlement, the people who is assigned for the each different territories. And also we have the opportunity to have the censuses that the people who are without any disease, who are living at the community, but also we have the information of the people who are coming for our health services. And for that, we can, provide a really coverage and quality of the information for the different programs that we provided. Of course, we have a private sector also. It's working at the country, but we don't have relation yet to them with the public services. Only when the Caja Costarricense Seguro Social want to buy something from the private sector. But right now, they are pushing to have more opportunities to be at the public service. This is idea how is the networks that we have in our country. We have 3 networks, big networks, since the primary health to the 3rd level. There are a lot of information there, the communities to the national level. But also, that is important, the primary healthcare has a territorial spaces defined by geographic access that we call yet about the device. And of course, the vaccination is provided, but in house by house, at home, with keeping all the information in the records. Normally, our coverage is up of the 90 to 95 with measles and everything, all the different programs that we have. And of course, there is not the criteria, all the people who live in Costa Rica receive the vaccines. This is important. If the people are migrants, also they receive the vaccines. We have a law with the national vaccine law that define the governance of the vaccine programs, and also define the organization, how to add the new vaccines to the scheme with the technical issues that are, this is very important because the people who are in this commission are the technical people covering the different parts from the social security system, from the pediatricians association, from the Minister of Health. All of them bring the information. We have also the economists and the different kind of expertise to really analyze the evidence for each vaccine or new vaccine that we want to add to the national scheme. And for that they have a meeting every month, and this meeting are recorded, and you can review the different comments and the different aspects they have. Before the COVID-19, they have a lot of meeting, to approve this new vaccine for the faster that there was at the moment. The most important is that we keep there is a technical commission. And the technical commission is who decide what is the new scheme of the new vaccine or change. And they recommend to the politician. It's not a political decision. It's a technical. It's because you have to have the expert to analyze the systematic reviews, everything there is in the papers, in the scientific paper, but also what is happening with the community. What is the people feeling? What is the needs? What is the profile that we have? That is a very important, consensus. And this is the way that Costa Rica made the things. build the different point, put all the views in the same table and build the consensus. And the consensus is to do the best for the people. And of course, put the money, how it costs. Not only for 1 year, but because when you add the new vaccines, could be for this and for the next generations. And this is a very important to really to have the sustainability. When we are talking about here that the different kind of vaccines that are coming, we have to thinking also in the cost, how the universal health coverage could be, take all the moment and the precaution to really ensure that for the next generation you will have the money to really have the investment. This is an idea of the program that we have of the vaccine in Costa Rica. We have the different kind of vaccine for the people below 2 years, the adolescents, the adult people, how many. There is a very comprehensive scheme and very expensive, of course, for each person. But, as a public health and the global arena, if you are investing, you are saving life, and you have to keep this in the idea of the population. And of course, that I mentioned in the digital record for each person is the information. We have each person, I have the app in my phone with the different, my diagnosis, my treatment, my lab, and my scheme of lab. Yesterday we were talking about that we started adding the information with the moment of the digitalization era. We don't recover all that we have, in the past, because it's impossible, to really change that. But we start with that point, and at this point to forward, you will find all the information in your record. And this, if you are in the remote area and you go into to the central area, the doctor can see your record and look what is the situation that you have before, and review all the tests and the drugs and everything. This is a very important, because it's, this record is for the clinical idea, for the management, for the planification, but also for a strategic point of view. When I was a president of the Caja Costarricense of Seguro Social, I have my dashboard, and I can see what is the different production and the coverage for the diabetes, hypertension, malaria, whatever, in each facility. Before because I try to go to the facilities in the rural area, each Friday I went, and when I try to go, I review the information and then ask to the people if they are using this information. This is the most important challenge, how to use this information to really be useful for the people, or useful for the public, and used globally. This is one of the messages I want to tell you. The importance of the information, of the health information, has to be very important. First, for the people who are close to the person who you are taking the information. Then you can send globally. But if you send the information globally, it doesn't mean nothing for the people who are in the communities. There is not information, nothing to do it. You have to really believe and try to understand that this information is important because it's close to the people and the communities. And they change. They have to do something with this information. It's not only to type the information and send somewhere, and then you sit in the computer or on the TV and you are a number on that. No, totally different. When I start, talking and thinking how to present this about the partnership and governance, I was thinking that this program of vaccine is a very important partnership and build, the governance, parts of the governance of our system, because we really put in the center the civil society, the private sector, the health sector, the mass media, and other people, and try to build the trust. The trust is the most important issues. The building the trust for the vaccine program is a really, really very important to really, if you are looking for the sustainability. Sometimes the people, when are talking about the sustainability, are talking only on financing, but the trust is the most important. Because you maybe have 20, 30 years building the trusting, and you lose in 1 minute. And if you lose this trust in 1 minute, you lose your health system. And you lose, the credibility of the people, of the personnel, of the doctors. And for me, during the COVID-19, I was very, observing what happened all over the world to really keep the trust in the vaccine for COVID. Because if this not working, the impact in the national program will be terrible. But as a global, we made it. Yeah, and I think it's important to take in mind that. And some lesson learned from the Costa Rica. I think is the governance and confidence and sustainability, as I mentioned, not only the budget, it's also the trust of the people. Of course, a universal health system based on robust PHC, primary health care, and the knowledge-based decision. This is, the technical mentioned before. The health education and training, how to really keep the health education and training, not only for the people who are working in the health system, for the population, for the media, for the people who are around, who has, the idea is influence the population. The permanent evaluation and research. You almost have to include in the budget how to evaluate the program, how the people are taking the vaccines, what is the complete scheme, not only the first doses, because you lose something people there. And of course, the knowledge and the relationship between the researchers, the politicians, and also the stakeholders. And the ability for financial resources and training of health professionals, since the technician, the community, to the national level. I am on time, yes? Yes, okay. The challenge, of course, we have a lot of challenges, most of them but I think in the first, the new pandemic or global risk, social conflict, and climate change. This is very important. We have to be in another, point of development of the response globally than that we have during the COVID. And this is really important to be resilient, The new vaccine development developed by the record time. The this record time with the COVID-19 was very stressful when we were thinking how to build the saving made the polio vaccine. This reducing of the time, it's very important to really have in mind that it change everything. You have to have the change the culture. How do you feel? How you prepare the budget, the planning? How you elaborate the protocols, everything. And this is a really, really, tough feeling that we have to face it. Of course, the dependence of vaccine production outside of the country and outside of the continent sometimes. I think in the previous conversation, I want to add that there is not only the dependence for vaccine production, it's for the knowledge. It's very important to, as a global people, to really understand that the knowledge has a gap between the north to the side. And the decision that you are taking globally, or we are taking globally, has impact at the local communities and the local personnel and the local media. All of them bring to me the idea, and I realize that the COVID-19 was the first pandemic in real time. This is really different than the other. The other we read in the papers. We know several months after. But in this moment, and maybe in the future, could be the similar. And we have to be prepared. The adherence of the population of the vaccine programs, because there is anti-vaccine people growing all over the world, and they are taking, the personal, they are approaching the political, they are approaching the technical people, they are approaching the medias to really put this confusion, against the different decisions that the countries has to make. And of course, increase and invest in the pharmacological surveillance about the adverse events, that there was not the idea during the COVID-19. And for the next, we have to invest on that. Why? Because right now, we don't have any information against to the people who is against the vaccines programs. We have to really build the pharmacological review and invest on that. Of course, the genetics and all other investment. Of course, the fake news about vaccines was amazing. The people, I don't know, I was so lucky to read in the many things that they were coming with the WhatsApp or whatever. It was amazing, the fake news, and the people. Yesterday we were talking. Every day I knew new epidemiologists. Was, like you open the cornflakes, and then there's a new epidemiologist knew that they have to do something about that. And how you control that? Who will regulate that? How we can, a global arena, really build the ethical issues and really to be no chaotic in this moment that there is very important. And of course, the advocacy for vaccines programs by health personnel. This is a very important. How the doctors, the nurses, the technicians, they feel about the new vaccine, they modulate the population. If they don't trust, they pass this information to the population. And sometimes we suppose they know. Um, and the last point is how to really thinking in the vaccine as during the life course. Not only with the child, we don't need for adult people, not for the elderly people. And this is a challenge for the health system, for the investment, how to really support all those sustainability for the health system and the vaccine. And the vaccine are one of the most important programs for the public, because maybe you don't remember, but the measles, the polio, there are not anymore close to us. It's a very successful history globally. If we lose this opportunity to really build how to prevent, and I come back again, how to build a better society, healthy society, with the vaccines, one of the instruments, not only one, but it's one of the very important instrument. As at the global arena, we need to really think about how we can protect our, investment, but also how we can support to the Minister of Health, the governments, the population against the people who don't want the science, that they want to be the chaos, because there is a risk, a big risk for our humanity. Thank you very much. Yes, I take it.
I'm having bad luck with I have bad luck with the microphones, but thank you so much for that wonderful description and deep dive into the health system. And I'd love to turn to the audience for any questions. And I wonder if we have any from our online audience. Okay, great. Thank you.
Hi, yes, we do. We have a question from the online audience asking, what were the most successful strategies to gain the population's trust in the vaccines and education and training programs? And how does this relate to strategies for building trusting partnerships?
I think the most important is to bring the knowledge with a simple way that the people really understand. It's not only past, the evidence for the different stakeholders. It's build the message that the people understand, but not only because we teach they have to understand. It's because they really want to learn. Some people talk, this is a heritage, the health heritage with the health services. How literance, literance. How you build this knowledge on health that the people need to know, but not only to, what I can say, it's a health education. How you build the concept of health, and what is the value for the population to be healthy, and to be really to support this. And this is we are talking really a health promotion. How to be more than without disease. This is one, and the second is build with the different stakeholders, even the people who don't like you to be on the table. Because it's better to bring the people to the table, bring the ideas, recognize What is the ideas or what is the knowledge they have, and try to build together the well-being. How we can go for the common goals. This is not easy. Take time, take process, take transparency, but for us is the way to do it. Build to the table that believe the people who believe and that they don't believe. But if we can put in the table the arguments and build and recognize the different point of view, you start with respect, but also with the values where we are talking or we are looking for. And if you share the values, you can build the trust, and then the decisions are coming. It's not in the other way. Sometimes the idea is, I want to do this, you have to do it. No. We have to build the decision. And there is, take time. The people don't like it because take time. And especially the politicians don't have time. They are only a few years and then go. But the build the possibility and the route for the long route is very important. Also building the resources with the stakeholders, and is not only the money. The most important to put in the table is the knowledge. And if you recognize every person has their own knowledge to put on the table and then build on that, you can go forward. If not, it is impossible, even if you don't agree at the beginning. Many times I say, oh my God, this is the same person. It's difficult to talk with this person, but we have to take a water, drink a water, and sit and start talking and building, the trust and the knowledge and the arguments. If the people doesn't have arguments, you can't talk with the people. You can't. This is my experience. If the people doesn't bring the arguments, it's because they have the power to say no. Okay, we have to go around and look the other people and, find a way to do the things.
We have time for another question or two. June.
Hi, I'm June Ehrlich, the editor of Revista, and we just happened to be doing an issue on Costa Rica. I was wondering if you could elaborate about the pressures towards privatization. Is it just a matter of funding? Is there a disinformation campaign? What's going on? And also, how can the international community, those organizations represented here and others, support Costa Rica in its effort to keep a universal health plan?
There is a different ways to take the idea of the privatization. Some of them is ideological. The people the people want to take the money from the private to the public to the private, and we don't want. I think it's in the case of Costa Rica, we have a long history to working for the private sector. It's not, we are working together. We have and keep the national public services, but we have some relationship with the private sector. The different right now is that this private sector wants to have a piece of cake of the health system. They want to have a piece of cake of the primary health care or the hospitals, or some of them want to go to insurance, And what I can say, right now the pivotal, the point is the election, that the free election for the doctors. They want to bring to the doctors, the population, the option to select the doctor they want to treat. And this exactly is inside to stress the solidarity and to stress all the sustainability, because most of the resources, they are not in all over the country, in the private sector, in other countries, the most of the facilities private are in the urban area, but the people who are living in the rural area, they are, expecting only for the public services. For us, this single decision that they are pushing right now for the people has the opportunities to select the doctor they treat, is exactly go in the heart of the health system. Because you lose the control. You lose the control. How can you ensure that the national programs of the coverage you will have, if today I went to do this and tomorrow I went to the other? It's impossible. How you can, follow the information for the person and for the, especially for the community, for the, collective results. I think this is one of the biggest issues that we have right now. And I think the most important that the global arena can do it's to really read about that we have in Costa Rica and what we are losing and what is we are expecting and what is the example we have in Latin America and in other countries. This kind of reform change the totally different in Chile, in Colombia, and in other countries. It's not only in Costa Rica. They change everything. It is to really, is what I can say, it's like pass a history, pass a history, and really cut the solidarity of our health system. This is a very strong moment for us to really support. It's amazing. It's a person like me. I was in the decision making to strengthen the system, and now someone coming and say, no, this is so bad. We have to change. But our system is not in bankrupt. Our system have the good personnel. With personnel is very good training. We have a very good facilities. We have a population with education and access. And most of us, we are fighting and resistance.
Thank you so much. Really appreciate that.